Hello and welcome to Pain Management 102. This is a second lecture in a series of pain management lecture, and it's structured around therapeutic principles of how to treat pain. So let's look together. Where does success in pain management come from? So success in pain management comes from understanding that you really need to take into consideration the entire picture of pain pathophysiology in order to successfully treat pain. So you need to understand what is the cause of pain, what's the pathophysiology of pain, what other comorbid conditions or different disease states does a patient have. For example, if a patient is a diabetic and his diabetes is not controlled and we're treating him for diabetic neuropathy, perhaps we also need to treat his diabetes, because otherwise, if the diabetes is not controlled and we're treating his pain and he's continuously having different microvascular complications of diabetes, his pain is only going to get worse and our efforts are going to be wasted. That's why understanding comorbidities is important. What is a proper drug selection? How do you effectively select the right drug for a patient? Maybe you need to understand what is a side effect profile for this drug. Maybe you need to know other factors. For example, some drugs are renally metabolized, some drugs are hepatically metabolized. Maybe a patient has a chronic renal failure and we're giving him a drug that's renally metabolized. So he may suffer a drug toxicity because the drug is going to be retained in his body and not excreted in a timely manner. So all of those factors will play a role. Application, and then finally, how do we actually construct a successful drug regimen that is ideal for this specific patient. So now let's look at the more global view. So in pain management, we're going to take a multimodal approach. And what that means is that we're not only looking at pharmacotherapy, but we also need to realize that in order to successfully treat pain, patient might need physical therapy and rehabilitation. Perhaps some patients like to use complementary medicines such as naturopathic, homeopathic. Ultimately, the patient will need to make some lifestyle changes. Perhaps this patient has osteoarthritis and has a really weak muscle tone. They're not exercising. So in order to strengthen the joint and help build support, they need to build some muscle tone and start exercising. And of course, psychological support, because some of the pain conditions are very detrimental to health and very debilitating. So with some of the chronic pain conditions, people can develop depression and anxiety. So they will need proper psychological support in order to successfully treat pain as well. So contributing factors, we already talked about this a little bit, but for example, two big ones are diabetes and depression. Like I mentioned, diabetes can have severe microvascular complications if somebody is not sticking to their drug regimen. Maybe they're not injecting their insulin, maybe they're not taking their diabetes drugs or not following proper food care. So our efforts to treat pain sort of will be like wasted if they're not seeing their doctor regularly and if their diabetes is not controlled. Same with depression. Somebody who has depression and pain, they really need to stick to their drug regimen and receive proper treatment and an adequate amount of social support in order for us to be successfully treating pain. So here, this picture and this particular clinical guideline has absolutely nothing to do with pain. And the reason why I have it here is because I want you to understand the concept of clinical guidelines. So how do doctors know which drugs to use for treatment of disorders? Obviously they learn it at school, but when they leave school, what principles do they follow? What recommendations do they follow to actually treat pain? So here are guidelines. This is DNC-8, and these are basically guidelines how to treat high blood pressure in adults. These are published in the Journal of American Medical Association, and you can see that these are very specific recommendations. These are just a few that I added, but you can see here it says in the general non-Black population, including these with diabetes, initial antihypertensive treatment should include a thiazide diuretic a calcium channel blocker, angiotensin converting enzyme inhibitor, ACE inhibitor, or an angiotensin receptor blocker. So these are all drugs, thiazide type diuretics, ACEs, and ARBs. So you can see you have very, very specific recommendations of how you treat high blood pressure. And these sort of recommendations or clinical guidelines also exist for the treatment of different pain disorders. But it's good for you to know that these exist because you can always reference and say that, well, actually, clinical guidelines recommend this treatment for the condition X, so that you know that the body of medical science and medical professional actually recommends these specific treatments. So they're backed up not just by science, but the medical profession in general as well. And here, lastly, let's look at this slide. This slide just illustrates to you another way to look at the multimodal approach, but this one specifically applies to the pharmacotherapy. This is a reference to a pain transmission pathway from the periphery. Periphery refers to your peripheral nervous system, your limbs, your legs and arms, to actually brain, where pain cognition and the formulation of the idea of pain occurs. So this is where you actually realizing, oh, I'm feeling pain right now. I should probably move my hand away from the hot stove. So you can see that along this pathway, there are several different junctions. And at those junctions, you can use different drugs, and you can see the drugs are listed here, to actually target the pain, to actually try to stop the pain signal from going in this pathway. So we're going to learn how to effectively use these drugs in order to stop the afferent transmission of pain signals and try to mitigate the feeling of pain. So thank you so much for your time. This concludes the end of lecture 2, and let's move together to lecture 3.